All right. So we've been together for a few hours now. If you don't know the person you're sitting next to, I want you to take a look at the person you're sitting next to on either side. Do it, do it. Say hi. Say hello. I'm not going to ask you to hug. Shake their hands. An interesting thing to think about as you're looking at the person next to you is that statistically, in your lifetime, one or two of you will develop diabetes. It will start out innocuously enough. Maybe you're feeling a little hypoglycemic when you're hungry. And so you go to your doctor. And your doctor tests your blood, and he says, oh, you're fine. It's a little high. Just watch what you eat. And so you do. You maybe, get a subscription to Men's Health. And you kind of exercise a little bit, take 1 teaspoon of sugar out of your morning coffee. And then Memorial Day rolls in. Damn, it's been such a long winter. I'm going to let myself go. Just this once. And you do. And then you kind of forget the whole summer and the next 2 years. And so you go back to your doctor. A couple of years later, you feel a little worse. And he tests your blood again. And he tells you this time that you have what's called prediabetes. But it's okay. There's a pill for that. And so he gives you the pill, and he says, just watch what you eat. And you watch what you eat. You take the pill. If you have a treat, you take the pill again. And it kind of manages your sugar for you. And you kind of make little changes, but not very much, because it's really hard. Fast forward a few more years later, maybe you've gained a few pounds, but we all do, because our metabolism slows down. And you go back to your doctor, and this time, you have diabetes. And he puts you on insulin, and he also tells you, unfortunately, you have the beginnings of heart disease. And suddenly, life moves a little bit slower. And that person that you were a few years ago that was feeling a little hypoglycemic seems like a different person altogether. Today, 1 in 3 Americans has diabetes or prediabetes. Some of the more dire estimates say that in as little as 6 years, 1 in 2 Americans will have diabetes or prediabetes. That's every other person in this room. Perhaps even more astounding is that every children, 1 out of 3 children born after the year 2000 will develop diabetes. Such damning numbers. I have 3 children, and I think of that. And so, is there hope? Yes, there is. Diabetes is reversible. The trends are reversible. How do we do it? Prevention. What does prevention mean? Everyone gets this right. Come on, everyone will get a kiss from Richard. More exercise, eat better. But what does eating better mean? In 2010, our diet surpassed smoking as the #1 risk factor for death and disease in America. The #1 risk factor for death and disease. And the prescription for prevention seems pretty straightforward. 7 servings of fruits and vegetables a day lowers all-cause mortality across the board. Put banana in your cereal, eat a salad for lunch, have an apple for snack, get a generous side of broccoli and carrots for dinner. You have your 7 servings. And yet, only 5% of Americans are getting the recommended daily allowance of fruits and vegetables. And what's even more astounding is that the half of the fruits and vegetables that children get are from sugar-packed juice. That's like counting pizza as a vegetable. I know that you can reverse chronic conditions by changing what you eat. When I was in my 20s, after many years of what seemed like premature arthritis, a doctor finally diagnosed me with what's called fibromyalgia. Fibromyalgia is a syndrome with a constellation of symptoms, and doctors will give you a pill for each symptom. So I started taking these pills, and I started managing the pain. The pain didn't disappear, it was managed. And because of that, I was considered a success story. So I took these pills for a few years, And then after a couple of years, asked the doctor, when can I stop taking these pills? And then he said, maybe never. I was in my 20s. I had at least 65 more years to go. I couldn't imagine taking prescription medication for 65 more years. And so I did a little research on the internet, and suddenly I was reading all these stories about all these hippies and New Age people changing their life with food. I was like, what? My diet of pizza, hamburgers, supermarket circular specials is not the right one, and it's endangering my health? Really? And so I said, okay, I'll give it a try. So I started to change the way I eat, and it took a time. And after a few years of really thinking about my food, I actually reversed my condition. I got off all the pills, and I became one of these success stories. And like everyone who sees the light, I started wanting to write about it. I started wanting to preach, and I wanted to convert. But then it was really hard for some people. Some people found it easy. But for some people, it was not something that they could do naturally. And I kept on thinking, why? And then I was realizing that our relationship with food was changing from intimacy to estrangement. 52% of Americans find it easier to do their taxes than to figure out how to eat healthy. We spend a mere 27 minutes a day preparing food. That's actual, full-on contact time with food, not the time we spend taking pictures of it and posting it online. Not only that, we're spending less of our income on food. In the 60s, we used to spend 18% of our household income on food. Currently, we spend less than 10%, and increasingly, that's food away from home. And we're also buying more processed food. So spending less time, less of our money, and buying processed food. But we almost don't stand a chance. Fast food industry spends $4 billion a year in advertising. The processed food industry spends $2 billion. The Center for Nutrition Policy and Promotion of the USDA spends $6 million. $6 billion for the processed and fast food industry, and $6 million for broccoli, carrots, spinach. It's a David and Goliath story. And it's exactly these trends in our food and our health that spurred the food movement as we know it today. The food movement, which I consider myself part of, battles to put fresh food on our table and give access to everyone. Food deserts, school gardens, urban farms, community-supported agriculture, acceptance of SNAP and EBT at farmers markets. These are some of the initiatives that the food movement has brought to help us get back to real food. And most of it, for many of us, it has worked. Our health is improving. But as I was seeing, as we look at these trends, for many, it wasn't. And I was looking at the situation, and I just kept on thinking about something that I used to work a lot on when I started to work in technology. And this is a network. And in networking companies, one of the most important connections is what's called the last mile. So often, it's called the last mile problem. It is that leg of a network that delivers the data, the water, the service to the household. It is also the most numerous of connections, so it's the most difficult to upgrade. So what is the food movement's last mile? We are losing something that is very basic. We're losing an evolutionary milestone that has implicated our survival and has set us apart from other species. We are not cooking. Less than 50% of the main dishes at dinner time are made from scratch at home. Now, it's good to note that NPD, who's done this survey since 1985, has stretched that definition of from scratch so thinly so as to keep a viable sample going. We're not using our stoves. What the heck are we using? So cooking is the proverbial last mile of the Food Network. It is our connection to the food. It is the way that we really touch our food, and we really use it to help our bodies. Why are we not cooking? Again, top 3 reasons on the board. We don't have time, we can't afford it, we don't know how. So let's look at the first one, we don't have time. This is the American Time Use Survey of the Bureau of Labor Statistics. You spend 27 minutes a day preparing food, and 2 hours and 30 minutes a day watching television. And I bet we spend 15 minutes a day trying to figure out what Cat Stevens song or Christopher Cross song we are. How about we can't afford it? For sure, for many, that is a problem. But for most of us in this room, that's not true. And yet, our health profiles aren't different from the larger population. Mark Bittman's article in the New York Times makes it pretty clear. A meal for 4 at McDonald's is about $28, and food made from scratch is about $9 to $13. So we can't afford it. We do have time. What about the last one? We don't know how. I want you again to take a look at the person on either side of you. Say hi, look them in the eye. Because one of you does not know how to cook. In fact, 1/3 of Americans admit they don't know how to cook, and 53% of us feel we have less knowledge than our parents did. And so what are the implications of losing this evolutionary milestone? Think where we are now in our health. What can we do? There's 4 things. The first is that cooking as part of prevention must be a public health imperative. In the same way that we promote vaccination to prevent communicable diseases, we should promote cooking as a way to prevent this epidemic that we're in. Right now, we put an ounce to prevention and a pound to cure. The federal government spent $80 billion in diabetes management versus $0.2 billion in prevention. Doctors need to be educated in nutrition. In 2004, the average medical student received about 22 hours of nutrition education in all 4 years of medical school. In 2013, that went down to 19 hours. How can doctors prescribe something they don't even learn about, something they themselves don't know about? The third is we should educate our children in nutrition education. Bring back home ec and make boys and girls take it. This is my son's and daughter's school, and one of my favorite days to volunteer is when the chef comes in. They have a school garden run admirably by Grow Pittsburgh. And during the height of the season, a chef comes in, takes the seasonal produce, and makes amazing stuff with it. This is ratatouille, and the kids admit it, they gorged on zucchini. They loved it. And then I had to escort them back into their lunchroom because it was lunchtime, and they had microwave chicken nuggets. So even at the school level, the farm-to-table connection is broken. And yet we know it's possible because 2 miles down the road at a charter school, kids eat food made from scratch. And that school employs 2 nutrition educators, and they have a school garden. They close the loop. And these children understand that food is something that goes from the ground to their plate, not a pretty thing to look at on the ground. The fourth is that cities should make health and nutrition a central part of public policy. It is estimated that for every 100,000 residents, it costs a city $50 million to manage obesity. So for the city of Pittsburgh, it costs us about $150 million a year. That is about 30% of our city's operating budget. So imagine what we can do with that. The Center for American Progress identifies building healthy cities as central for urban progress. And that is something that our city and all cities should embrace. This is Square Food in Bristol in the United Kingdom. where for $5 a class, you can take any cooking lesson, any cooking class that you want to. And it's supported by public and private partnerships, and it's a thriving school, and it's changing the way the city eats. But teach not only cooking, because really the key is not just learning how to cook, it's learning how to reintegrate cooking back into our lives. Teach budgeting, teach time management. It's really a kitchen school. If the kitchen is the hub of a home, so does it need to be the hub of a healthy city. So cooking needs to be central to the food movement's initiatives of network of initiatives, not an auxiliary of all the other initiatives. Because putting our relationship back to food means putting our intimacy back to food. And the way we do that is to touch our food, to understand how to prepare it, not just how to plant it, but actually how to eat it. Cooking is basically how the farm gets to the table. So we've all heard that we should vote with our fork. But before we can even vote with our fork, we must stoke the fire of dissent against the trend that our health is going. And that fire is on our stove.